This is kind of like also what you've experienced. I mean, most patients who come to us have been overweight for many years. They've tried diets on their own. Maybe they've gone to dietitians, maybe taken pills. And the way it usually works is you lose some weight, and almost everybody can lose some weight, 5 pounds, 10 pounds, 30 pounds. But eventually it kind of slows down, and then it takes forever to lose another pound, and it gets frustrating, and you still haven't reached where you want to be, and then it gets more frustrating, and then you say, oh, what the heck, and that's not worth it, and you start eating again, and the weight comes back. And a lot of people, unfortunately, go through that yo-yoing, and it's very frustrating. But the good thing is that we can help you with that process. We can break through that and get you to where you want to be. And once you're overweight, unfortunately, a lot of bad things happen. Obesity leads to, we all know about diabetes, high blood pressure, sleep apnea, heart disease, fatty liver, joint problems, acid reflux. A lot of women have no menstrual period. They have no regularly. They can't get pregnant like this woman in the video. Shortness of breath, depression, even liver cirrhosis. People don't think of being overweight as a cause for liver cirrhosis, but nowadays we know that first your liver gets fat. Everybody who is overweight has a fat liver. Then it becomes scarred, inflamed, and then it turns into cirrhosis. So it's a frequent thing. Unfortunately, also we know now that weight causes a higher risk of cancer. Breast cancer, colon cancer, cervix, uterus, pancreas, all these cancer rates are higher in people who have been overweight. Surgery is the only proven thing that works for a long time. So you're going to lose a lot of weight, you're going to lose it fast, and a lot of people keep it off for a long time. And that's really what you want. You want to keep that weight off for a long time. And that's the only thing that helps with that is actually surgery. This is kind of a busy slide, but it sums up, and I'll take you through this. So the top part shows you how much weight you can lose with exercise, diet, lifestyle changes, maybe even medications and so forth. This is what the studies show. At 1 year, you can lose up to 10% of the body weight. Okay, these are only 1 year studies. No one has really looked at 5 or 10 or 15 years, because we also know that almost everybody who's lost some weight gained it back after 2 years. It's very rare to keep their weight off. So that's for all the efforts that people make, all the things that are out there that are offered to you. Unfortunately, this is what happens to most of these people. In comparison, for surgery, this is what we see after 1 year. People lose 70% of their overweight. Okay, that's almost for everybody. First year, everybody with a gastric bypass, in particular in the sleeve, everybody loses weight. Everybody loses a lot of weight. But then, the good thing is, even after 5 years, still, people keep 60% of their overweight off. And there's even a study that shows after 10 years, this is out of Sweden, where they have a very controlled social medical system, even after 10 years, 50% of the overweight is still off. Okay? So you can see it's a long-term effect, not just for a year. For a long-term effect, you lose a lot of weight and you keep it off. And that's really what you want. And with all this, a lot of good things happen. Your chance of dying earlier is down by a quarter. And that's because heart disease is down, diabetes and cancer deaths are down. And then other things are cured. High blood pressure, diabetes, a condition called sleep apnea. All these problems are much improved or cured after people have lost their weight and when they keep it off. Yeah. And then again, a lot of other things are improved. This shows you what all the things that can happen to you when you're overweight. And these are numbers, how much things are reduced. This is from the Cleveland Clinic, so that's their numbers. So essentially, acid reflux is dramatically down, particularly with the gastric bypass. People have much less problems with asthma, shortness of breath. We have problems here sometimes, patients who come here and they come with oxygen, or they come with crutches, or they come in the wheelchair because they just can't walk. The joints are hurting so badly. And then we see them again 6 months later, a year later, they're off their oxygen. They don't take any asthma inhalers. They don't take any steroids anymore, any cortisone for their asthma. They walk. They got off their wheelchair. They got off their crutches, and they're walking. It's amazing. We have people who started running. We have people who run marathons, 5Ks. It's all amazing. I mean, you saw Ed Cooley talk. I mean, he's obviously in the field, but he does exercise every day, which he didn't do before. So it's an amazing thing. Same thing with the joint pain. Some people need knee replacement, hip replacement, and the orthopedic surgeon will not do it until the weight is down, because he says, I'm going to put the new hip in there, but you're going to ruin it in a year or two because of the weight. So let's just do the weight loss surgery first. We talked about liver disease. That fatty liver that most of the people have who are overweight, that'll go away once you lose the weight, and your risk of getting liver cirrhosis. Menstruation, women who have had problems conceiving and having a baby, now they have no problems. Like the person you saw in that video, she's had one child before the weight loss surgery, but that was with lots and lots and lots of help, medical help. After weight loss surgery, no problem, she had a baby. As she said, she gained a few pounds, she lost it. Next baby. So she has 3 kids right now. She's very happy, the weight's down, it's a happy family. So this was much facilitated with the surgery. Some people have urine incontinence, some women have urine incontinence, and the weight doesn't help with that, but once the weight comes off, this helps. And as I said, social, professional problems. People just, they can buy off clothes off the rack. You can go to any store. You can go with your kids to amusement parks. You can ride on the rides. You can go on an airplane. One woman had told me years ago, her biggest thing was that she was able to cross her legs. And I was like, that was an eye-opener for me. I'd never heard that, but that was tremendous. And people have gotten job interviews. We hear so many great stories. It's just unbelievable. So that's why we like to do that surgery.